So today I'm talking to the wonderful team from Hartland and Bradworthy about their experiences with Emma, a student who's been placed with them from the University of Bolton. So Holly and Rachel, if you'd like to introduce yourselves first of all.
Hi, so I'm Holly. I'm the practice nurse at Hartland. I've been there since about May 18, but I was a qualified practice nurse before that. I was in the Air Force and decided to leave to have my family and moved back home to North Devon. So Hartland has taken me under their wing and I'm the standalone practice nurse there. So busy clinics, lots going on, and great place for students to come and learn about GP practice in a very rural community setting.
Thank you. And Rachel?
My name's Rachel. I'm one of the practice nurses at Bradworthy. I've been working here on and off since about 2008, more and more hours over that time. So I now work here part-time, but I also still work in secondary care. So I work a lot with students on wards within the hospital. So it's been very refreshing to have a student in primary care to show them what it's about. I'm really enthusiastic about primary care nursing, and it's good to show them what it's about.
That's great. Thank you for that. So can you tell me a little bit about why your two relatively small practices, and can you tell me why you were interested in having students?
So it really came from me, I think, to start with, because I'm just very keen on the fact that general practice has generally been a little bit seen as what you would do after you leave secondary healthcare. So it may be, as you get close to retirement age, you might come out into general practice once you're a very experienced nurse, which is what we need. But I feel like there's going to be a bit of a generational gap if we're not very careful, where a lot of our brilliant, experienced, long-standing practice nurses will leave, and we won't have anybody except for me and Rachel to bring up the rear, as it were, and make sure that people are, still getting good quality care. So if we don't invest in the future by having student nurses, we're not going to have any good general practice nurses, in 10, 15, 20 years time when we want to retire. We're going to leave everything empty-handed if we're not careful. So putting in lots of support for student nurses will train people the way that we were trained, and will turn into good nurses who care about their patients and want the best. So I had to then try and approach the PCN, so our primary care network, to ask if any of the surgeries in our area who we work with, so we're a group of 6, wanted to come and have a student with me. But unfortunately, pressures of their practices meant that they couldn't. So then we reached out to Bradworthy, being very rural. Both our practices are very rural. And I already knew Rachel, and I knew that she worked in secondary care and had students. So that was our step forward, to be able to come a group together, the two practices.
Yeah, that's lovely. And Rachel, you've already talked about your experiences in secondary care and how it's been refreshing. And so anything you'd like to add from your perspective about why take on students in primary care?
Well, I think we've been quite keen in the past, but we have to work with a small building. We don't do specific clinics like a lot of the bigger practices will have asthma clinics or diabetes clinics. We tend to be a jack of all trades, and it was difficult to accommodate a student full time. So that's always been our sort of drawback. So having somebody to share a student with has just been what's made the difference for us.
Yeah. And I think it's a lovely example, as you rightly said. It's two small rural practices, geographically though not very far apart, and so you've worked together, and it's been great from both sides there. Can I ask you a little bit about how the setup process was for you? Did you feel supported by us as a placement expansion team and the university to sort of put all the processes in place to have the student?
Yeah, I think that it's always a tricky thing when you're trying to set up something new that you don't quite understand how to set up. But there was quite a good process that we had, where obviously you were there to be able to support us, and obviously up at Petrock, the liaison lady up there as well was very good at emailing back and forward what we needed to do. And once we knew that there was obviously the procedure of having a kind of a checklist of things that just needed to be ticked off, and then you can work through that. It's relatively easy process to be able to go through. It still takes time, and obviously with us being busy nurses as well, it takes time to set that up, but once it's up and running, it's really easy.
Yeah, that's great. And for you, Rachel?
Holly did all the legwork, I have to confess.
That's good teamwork, that is, I think.
Very good teamwork. For me, it's been absolutely fine because, like I said, Holly's done the majority of the legwork. At the time, I've been studying alongside, so fitting anything extra was a little bit tricky. But no, for me, it's absolutely easy. Okay,
that's lovely. Thank you. So now Emma's joined us. Emma, would you like to introduce yourself?
Yeah, so my name's Emma Doherty and I'm a second year student nurse with Bolton University, but based at a satellite academy at Petrock in Barnstable. So yeah, this is my second placement of second year.
Lovely. And how did you feel about being allocated a primary care placement?
I was really excited. A few of the students from my cohort have already participated in practice placements. So the feedback I got from them was really positive. So that made me more excited. But I was also a little bit anxious and nervous because I knew that I was the first student that Hartland and Bradworthy had. So I wasn't sure what they were expecting as well. So yeah.
So tell us a little bit about some of the highlights of your placement so far.
I've really liked working at both surgeries because it's nice to have a bit of variety, because obviously, despite being on paper very similar with the patient numbers and things, and being a small rural surgery, they work very differently. So it's been nice to mix with both teams. I've had quite a few spoke placements, so I've worked with the GPs in both surgeries. I've worked with the physiotherapist. Yesterday I went out with the district nursing team that also collaborate with the patients from the surgery. So yeah, that's been really nice. And to me, it's a small team, which has been really nice because I feel both surgeries have really welcomed me. I think being a small team, it kind of helps a little bit as well.
Absolutely. So you feel part of the team then in both sides.
Yeah, and it's nice because obviously there's only one practice nurse at both surgeries, so Rachel and Holly have been really supportive, and I've had one-to-one time, which I've never had on any placements because obviously they've all been ward placements. So yeah, to have the one-to-one time has been really, really good.
That's great. Thank you very much for that, Emma. And so what advice would you give to other students who were allocated a primary care placement?
Go for it. It's been really good. Yeah, no, I've really enjoyed it. I mean, it's totally different than working at the main hospital and things, but I've really, really thoroughly enjoyed it. Yeah, I've really enjoyed it. I think it's definitely looking long term, even though I've still got a little way to go. It's definitely something that I'm looking for in the future.
That's excellent, and that's exactly why we want students like yourself to be exposed to all those that wonderful practice that goes on in primary care, because eventually you'll, like you say, you'll fill Holly and Rachel's shoes when they choose to retire, of course. Can you tell me some of your highlights then, Holly, about now having student placements set up at Hartland and Bradworthy?
So from my point of view, it's definitely about having somebody else there. So being a standalone practice nurse and working very much autonomously, you're not seeing somebody in your clinic all the time. You've got your patients and you talk to them, but it's nice as a confirmation of all the things you know, and also it helps you to think, actually we need to think about that a bit more. Why do I know that? How do I know that? And it gets that evidence-based practice going in your head. Where is the documents that I know that has come from that I show Emma? So it's really helpful for me as a nurse just to, I don't know, I think it's important to share your experience and to confirm what you do know, and then also find gaps where you think, well, actually, I do need to go back over that a little bit. It's really good for us, for a CPD, for our own benefit as nurses. We should always be learning. You never know everything. So that's one of my highlights. And also, it's lovely to be able to show the rest of my colleagues within general practice that nurses are students to start with, because they just see me and think, oh, I'll go and ask Holly about this, that and the other because she knows everything, and I can prove that I don't know everything. And I say, look, you know, we get a lot of questions, things that I don't know, but it's a lot of it is detective work. And so Emma's seeing that as part of being a student nurse, you're learning how other different professions work, because also we work alongside the GPs and, like you said, the physiotherapists. We're just a jack of all trades. That it's a brilliant place to be, general practice. And I'm sure Emma has seen that, and I'm sure any other students that come will see rural practice is the place to be, definitely.
Yeah, lovely. And in relation to your colleagues in wider general practice world, what advice might you give them about hosting students and the setup process to try and encourage others to become involved?
I would say it's definitely something to try, because it's really important for the future of nursing. I can't understand why you wouldn't want a student nurse. I think it's great fun. It's brilliant to have student nurses in. But, you know, just get some advice. Come and speak to yourself. Just have a talk to other people that have done it first. I think it's really hard at the moment because there's a lot of pressures on general practice. So it may not be the nurses that don't want student nurses. It may be hierarchy led as to why, you know, there isn't time for training. There isn't time to be able, because obviously when we have student nurses, we need dedicated time to be able to explain the procedures we're doing. Why do we do things like that? And if we don't have those set training times, then it does make it very hard. And that's why I think nurses may feel there's a bit of pressure because they're already running very busy clinics. So, but I would definitely advise, go for it, try it, even come, you know, if there's anybody who wants to come and sit in with me while I've got a student and just see if that's something that would help them see what do we actually do. Very open to that, definitely. But just get some advice is the key.
Yeah, that's great. Thank you both very much. Thank you to Rachel, who's been able to join us again. Rachel, can you just tell us a little bit about how it's been for you having a student in practice?
It was strange to start with, because obviously I'm used to students, but not in this place. So it's good. It makes you think about what you're doing and how you do it. It makes you think about what you do know and what you don't know, and it definitely keeps you on your toes. And it's also been about setting sort of homework and challenges for the students as well, alongside sort of the practical hands-on stuff that we do day to day, so they have a better understanding of patients we see when they come in, getting that background knowledge.
That's great, thank you. And what advice might you have for your fellow practice nurses who might be thinking about having a student but are a little bit hesitant at the moment?
I think you've just got to embrace it. It's the way forward. We need students in general practice. If you just look on the jobs list, there's lots of general practice work, and the only way we're going to do that is by showing them what we have to offer the NHS. So definitely very important for us to have students.
That's great. Thank you very much indeed for your time, Rachel. So thank you very much for joining me today, Andrea. And we're going to talk today about the setting up of Hartland and Bradworthy as a primary care placement. I'll let you introduce yourself first of all.
Yeah, good afternoon. My name's Andrea Mason. I'm a senior lecturer and TNA programme lead for the University of Bolton, based at Petrock, but I'm also part of the CPEP project, so the Clinical Placement Expansive Project. So I work closely with Devon Training Hub and Devon County Council to source and set up new placements.
That's great, and obviously I come from the CPEP team within the Devon Training Hub, and we've worked together quite closely and worked collaboratively in setting up the Hartland and Bradworthy placement. Perhaps you'd just like to tell me a little bit about that from your perspective and the support that you've given from the university to set that up as a brand new placement.
Yeah, it was really interesting. So I got contacted by Joe to say, we've got this new placement, they're really keen, they've approached us. We had a collaborative meeting, and I think it's really important that we all work together to really identify what it is that placement needs or requires in terms of not just student placements, but also any support that they need additionally from either us or Devon Training Hub. So we've had 2 or 3 meetings with the staff at Hartland and Bradworthy to really look at what it is they want from the learner experience, what type of learner they want, how long they want them for, is there any specific requirements. And then again, we've had continuous meetings to sort of up until the point of allocating a learner to that placement area.
So there's clearly a lot of support there for practices that might be interested in having a student. They're supported by yourself as a university and us as a placement expansion team. And they've been allocated a student now, I understand. And I've also understand that contact continues, so that support doesn't end at student allocation. It carries on.
Oh yeah, completely. So we, for any time they've got concerns about the student's practice document, or they know that they can contact me, and they do actually they do contact me and say, look, what are we doing with this and what are we doing with that? And you know what, if necessary, we'll just go out and visit them and sit with them and go through any documents or any issues that they've got. So I'm, most of us quite happy to get in the car and drive to where we need to go to.
Yeah, that's great. And so just to finish off, really, clearly we're looking to create new placements and opportunities for students across primary and social care. Any bits of advice that you could give to any potential placement providers out there?
Yeah, so just think about your workforce planning, and I think that's something really important. And I know that there's a lot of work going on with Integrated Care Services Devon and with the Devon Training Hub and Devon County Council to look at the workforce planning, because it's so important across the whole Devon area. And then to come and have conversations with us to see what it is you actually want and what you need, and what will support your workforce and what your workforce can support, because it works both ways.
Sure. Yeah.
So then we can really work with you to look and meet with you regularly to make sure that you've got all the resources you need, so that we can support you with whatever learner you decide to go with.
Yeah. That's lovely. And clearly, so there's all that support from the university and the placement expansion team helping with that process as well. So I think the key message is talk to us and explore the opportunities out there, and we're here to support.
And we meet regularly, don't we, Jo?
We do. We do. That's
in
right.
Various forums.
Sure. Yeah. That's right. That's lovely. Thank you very much for your time, Andrea.